Can you imagine your vagina looking like this? This is what my vagina looked like for 24 years of my life because of a practice called FGM, female genital mutilation. That is a vile criminal act towards young girls.
If someone has had FGM, specifically infibulation, can they give birth vaginally? The answer is yes, but I want to talk about how, because FGM has so many severe impacts, but particularly when it comes to pregnancy and birth. So infibulation is the most severe form of FGM. It's known as type 3, where the labia are sewn together so it's closed, leaving only a very tiny opening where the urine can come out. And unsurprisingly, it can have a serious effect on childbirth. Actually, before that, in order to even get pregnant in the first place, that woman must either be impregnated because semen is placed on the outside by the tiny opening, or they're forced to endure penetration through that very tiny opening. And that will usually force that opening to rip open wider. And if they then are able to become pregnant and they haven't had their opening, their infibulation torn open through intercourse, and they're planning to have a vaginal birth, then during their pregnancy, women do often need a procedure called deinfibulation, where that scar tissue can be opened up safely by doctors or nurses. This can allow them to pass urine more easily, as well as other parts of the pregnancy care that we like to offer. So deinfibulation can be done in pregnancy, so antenatally, or they can have it done during labour, but antenatal is often safer and less traumatic. But without that deinfibulation, complications can happen to labour. They may get obstructed labour, they may get a higher risk of severe tears because scar tissue tears differently to our normal tissue. And there may also be just delays in receiving the care that they need. For example, if they have got a closed opening and we need to get in to help to deliver their baby quickly in an emergency, that may be delayed because we then need to do this additional step of the process. Now, ultimately, the aim either during or at the time of birth is to open the FGM, to open the infibulation, and it should never be closed again. After having their infibulation opened up, women should find it easier to have sex, to pass urine in the future, but they still live with the lifelong consequences of FGM. They'll often experience scar pain. They may also suffer due to the fact their clitoris and their labia were probably removed as part of the FGM they underwent. FGM is illegal in the UK, and it's also illegal to travel or take your daughter abroad in order for them to receive FGM. If you have experienced FGM, I want you to know this. There are specialist NHS clinics in the UK that can offer support, counselling and care that is tailored to your need, both during and outside of pregnancy. Without any judgment, there is never any need to be embarrassed about FGM. You deserve a birth that is safe and supported and centred on your well-being. So let's keep talking about FGM so that no one has to give birth without the care that they need. And this awful practice can be stopped for good.